Now, we all want to live longer. We want to have healthier societies. If we look across the globe, and many of you come from many countries, some of you are doing great. You can look here in the United States. Actually, our life expectancy has actually been dipping due to a variety of factors, including the opioid epidemic. I'm a physician, so I like to look at how many physicians have increased in the last few years, but you can see the number of administrators going up. That isn't necessarily correlated to better costs or outcomes, so we should look at base issues. So I'm going to take us on a quick sprint before we have sessions on measuring and optimizing longevity, happiness, 3D printing of organs, better diet, across a quick sprint about where some technologies are in health and prevention, diagnostics, therapy, and discovery. Let's start with health and prevention related to aging. We have a lot of diseases that are often the cause of death. What if we can start to understand those and prevent them in the first place? And there's lots of opportunities to do that across medicine. This is the cover of National Geographic's January edition. I had the honor of writing the opening article, 12 innovations that will revolutionize the future of medicine. It's actually not about any one innovation or technology. It's, again, how we put them together in new ways. And many of those technologies, again, are riding this exponential curve and give us an opportunity to address the healthcare continuum. From the desktop that, of 2000, which now fits on your Apple Watch, our mobile devices are increasingly becoming FDA-approved diagnostic devices. You can do an EKG on your watch. We have the opportunity to connect the dots, connect our data. The Internet of Things, computers the size of a grain of rice, embedded inside our bodies, in our homes, now riding 5G, 100 times the speed of 4G networks. So we have a new set of tools to make a lot of data, but we also have the challenge to unsilo that and bring it together in useful ways, so we're not just creating knowledge, but knowledge that translates to each of us to improve our quality of life and those of our families and communities, to narrow the gap between understanding data to information to actual clinical utility. So huge gaps between knowledge and actual application. Technology, of course, plays an important role, but by itself, technology is a so what unless we can understand how to pay for it, how to regulate it. How do we align the incentives not to spend almost all of our dollars, 80% of our healthcare costs in the United States, on those who already have chronic advanced disease? We'll hear from Dean Ornish later, who likes to say we don't practice evidence-based medicine, we practice incentive-based medicine. Our incentives are sick care. How do we start to move the puck to prevention and paying for health and doing that across the board so everybody improves? Some of that improvement is going to be riding our new digital connected mobile era. We can start to connect our digital exhaust, our genomes, our behaviors in new forms, and make healthcare and medicine more efficient. And it won't just be about digital and data. It's many of the things we've talked about here, from 3D printing to drones to chatbots to synthetic biology to AI, all converging, in fact, super converging, to enable us to rethink and reimagine many elements of healthcare and create entirely new fields. At the blend of technology and healthcare, which used to be just traditional drugs, devices, diagnostics, we have the emergence of entirely new fields, from computational biology, digiceuticals, robotic surgery, telemedicine, AI, radiologists. All these things are relatively new and emerging and are only going to accelerate into the next decade. Now, before we talk about maybe more high-tech ways of impacting health and wellness, let's start with the most important, which is really our often called social determinants. Your zip code is more important than your genetic code in terms of your quality and often your length of life. So we need to pay attention to the real core basics: clean water, vaccination, healthy society, and to understand that with the lens of the challenges of, let's say, the obesity epidemic, which is pandemic pretty much across the world. We can start to impact that early. If we take a child at 6 months of age, and I'm trained as a pediatrician as well, and give them whole grain cereals at 6 months instead of white rice cereals, and changes their microbiome, their epigenetics, and dramatically lowers their risk of type 2 diabetes and obesity downstream. So sometimes simple interventions early in life can be most impactful. We've now seen from the work of Dan Buettner and others understanding certain societies and cities and towns where they're often called blue zones, like Okinawa, Japan, where people live well into their 90s in very healthy ways and understand what has been contributing to their long, happy lives. A lot of it is the social determinants. And Dan Buettner and others have now looked at some of those often key things, we'll talk more about that with Dean and Ann Ornish, that can be super important, from sense of purpose to family to love to moving to being part of a belonging community, faith. All these things are fundamental to long, healthy lives. Aren't high tech, but we can start to understand them and bring them to societies around the world. So I've been lucky to be involved with Singularity since it started as the chair of medicine. And what's been interesting is many of the folks who've come from outside of healthcare have come to Singularity University and helped catalyze new thinking, new companies, new endeavors that help advance health and medicine. 8 years ago, I founded a program called Exponential Medicine. We've grown exponentially. We meet every November at the Hotel Del Coronado in San Diego. And we spend 4 days looking into the future of health, medicine, longevity, and beyond. And again, it's a team sport. We need to bring people from all sorts of fields together. And it's quite magical when you let people touch the future, like you've been doing here today, whether it's VR or learning about drones that might be not just delivering us, but patients and medicines, experiencing art, science, medicine, meditation. Many of you have met Swami here, who likes to say the only medication you need is meditation. So mindfulness can be important. We often have over 40 countries there, 500 organizations. We have some amazing faculty coming this year, including David Sinclair, who leads up aging research at Harvard Medical School. So hopefully some of you can come this November 4th through 7th. And if you go to the website exponentialmedicine.com, you'll see a lot of great talks from our prior faculty over the last several years. So let's look again at health and prevention as a starting point, because we don't want to wait for disease to happen. How do we get a handle on it, particularly early in life? How do we understand what diseases really kill us? Here's an exemplary chart. Heart disease is really still the #1 killer in most of Western society, followed by cancer, respiratory disorders. You can see all the way to the tail end are things actually like war and transportation accidents. So we need to start by attacking some of the most common causes if we're going to extend healthy lives. And sometimes that is understanding our genetics and our risk of disease, but more importantly, understanding our behaviors, because it's often our bad behaviors, our most risky 8 behaviors: poor diet, lack of physical activity, not enough sleep, SU, sleepless university, stress, too much alcohol. Some of us had a good time last night, but those taken to the extreme can cause many of our chronic conditions, which lead to early death and morbidity and a lot of the costs from our chronic disease. And now we're only 10 years into the era of wearables. Fitbit launched just in 2009. Now these are ubiquitous. I'm wearing 5 different versions of wearables. And these wearables go beyond tracking our steps and our sleep, but can measure almost every element of our human physiology and behavior. And we can use that data in empowering ways. Some of us are data geeks. We collect our data, our steps, our sleep on our smartphones or our tablets. That's quantified self. Where this is starting to shift is to connect that data to our healthcare systems, our physicians, our nurses, pharma, and beyond, to turn into quantified health, a feedback loop of often continuous data to let us do a better job of optimizing and measuring precision wellness, doing a better job of diagnosing a disease in early stages rather than late. And then if you do have a chronic disease, hypertension, for example, you might manage that in a much more continuous, proactive way. Well, what can we digitize today? We can digitize our weight. Old analog scale is digital. You may not want to, but now you can start to digitize your shape, which might include not just your kilograms, but how much fat mass, muscle mass you have. That can be utilized potentially to understand your course of progression and get you on a diet. The #1 cause of early death and morbidity around the planet is actually very common: high blood pressure. Half of American adults have hypertension. Now we're in the early age of connected blood pressure cuffs, or even smartwatches that have a blood pressure cuff built into the wristband that can be used for more continual measurements, or using apps to track your blood pressure medications, which can improve adherence. People often don't take their medications. If you take your blood pressure medication, you'll have a lower blood pressure and a much lower risk of heart attack or stroke. And we're seeing several companies build seamless ways of continuous blood pressure monitoring. So this sort of data will start to become continuous and can be useful. We're going to go beyond the wearables on our wrist to those in our shoes. It might predict someone who might have a risk of a fall. We're going to see wearables and insidables underneath our skin that are coming to market that can track chronic disease or normal behaviors and transmit that anywhere 24/7. Starts with the military world. We'll move to healthcare. We can start to quantify our most important drug, our food. Hippocrates said, "Let food be thy medicine, medicine be thy food." And now we can quantify our food. How many calories? Does it have gluten? Does it have peanuts? So we can measure our input and increasingly measure our output. Lots of data there. It's not pretty, but it can be useful. And we're starting to connect the dots to understand precision diets, like integrating our blood sugar data, our microbiome information, our physical activity to maybe tune your diet matching on you. And we'll talk more about the importance of food and reversing disease with Dean and Ann Ornish later. And we're seeing a lot of technologies evolve into the future of nutrition, from the Impossible Burger and Memphis Meats and Beyond Meat, which hopefully can provide even better environmental issues, because environmental health is human health, but better foods that match us and our physiology. We don't even need wearables today to track our behaviors. We're in the era of invisibles, software pioneered by Cocoon Cam,